Black women are 3 times more likely to die from childbirth than white women in the United States. That's according to the CDC.
A midwife here in Washington is working to end that statistic with a grassroots effort to open the first Black woman-owned birthing center in our state. King 5's Kayla Lafferty joining us live now with her story. Kayla, good morning.
Hey, good morning, Mimi. Jake. Yeah, so Faisa Farole has been a midwife now for years, and it started out as an effort to support her community, and it quickly turned into a mission for change. Faisa Farole runs her midwifery business out of a small office in Burien. She got her start in the childbirth industry working to help Somali refugee families navigate the healthcare system in the U.S., and she noticed a startling statistic.
Women were having higher cesarean rates in the Somali community.
After becoming a certified midwife, she decided to primarily serve Black families, and she found the rates of cesarean sections were just the tip of the iceberg.
Just been like so many just mild mistreatment, towards Black women. This was not just something that Black women were thinking, like it was just in their mind. It's actuality.
According to the CDC, Black people are 3 times more likely to die from pregnancy-related causes than white people.
We are witnessing how much representation matters.
Gemma Nonog is the president of the American College of Nurse Midwives for Washington State. They focus on diversity and equity in the medical field.
Black birthing people, Black women are experiencing less agency, less autonomy, less consent.
Others working in the Black birthing space see this trend as well.
I just witnessed families over and over again being really railroaded in the medical system and not getting all the options offered to them.
Rokia Jones is a doula and the director of community-based research for the Tubman Center for Health and Freedom, a new health-focused community organization working to offer care to marginalized communities.
The midwifery care model is really in its nature a community-based model.
Both Nonog and Jones say the issue stems from a lack of diversity in the medical field. In 2020, 6.85% of midwives in the U.S. identified as Black or African American, while 85.5% were white. For other BIPOC groups, the rates are even lower. This is according to the American Midwifery Certification Board.
There are just some things culturally about the ways that we express ourselves, the foods we like to eat, or things we understand culturally that we use for our healing and our wellness now, that it's beyond beneficial to have a provider who can show up in that space.
Faisa Farole is working to open the first Black woman-owned birth center in the state of Washington.
I think a birth center would be an amazing addition for the communities that I serve to have, and not just the families, but also for aspiring Black midwives to come and learn from.
When you hear about these efforts that she's kind of doing on this grassroots level, how does that make you feel about the future of where this is all headed?
I mean, it's about dang time, right? That we support, we wrap around as much as we can to make sure this happens, because this is what we have been looking for.
Faisa's Birth Center will be one step, right, as we're moving forward towards health justice and really taking care of people.
It's about making sure that a group of people that are hurt are getting healed. You know what I mean? And so that's what this is for me. It's about equity.
And one of the big models for Farole's future birth center is actually training more BIPOC midwives to get into the field and help diversify it. Live in Burien, Kayla Lafferty, King 5 News.